members of the Pan-African Parliament, our development partners, as well as all other participants, and greet them and also welcome them to this webinar, which is on a topic which is in line with the functions that they all hold, namely fair financing and tax justice for children in the context of COVID-19. Indeed, even if we know that the COVID-19 pandemic has spared relatively children, nevertheless, the children are not spared and free from its consequences, because the various measures taken, stringent measures taken by states have had serious consequences, and they have affected children in one way or the other. Even though the pandemic is still ongoing, we must nevertheless start thinking of this vulnerable category of people, namely children, by calling on every expertise available and all stakeholders and all policymakers. And parliamentarians are part of policymakers because they do have budgetary authority, and they could, of course, guarantee fair financing and tax justice for children in the context of COVID-19. Dear parliamentarians, by seeing you present in such a large number online, I do realize that you're all greatly interested in this theme and generally in the cause of children in general. And with your permission, I would like to give the floor to Honorable Chief Charumbira, who is the Vice President in charge of Parliamentary Affairs, by also specifying that Honorable Chief Charumbira is from Zimbabwe and who has been present in the Pan-African Parliament since its establishment in 2004. There's no better expert than him to discuss human rights issues, especially children's issues, particularly in this context of COVID-19. And I'm sure you'll understand that the fact that we've chosen him to open the session is not a matter of chance. While I thank you all for your attendance, dear participants, I'd like to request Honorable Chief Charumbira to take the floor and open the webinar formally. Thank you. Thank you, Madam Lynn.
Honorable Chief, vous avez la parole, s'il vous plaît.
Honorable Chief, you have the floor, sir. He has to unmute his microphone.
Madame Lee, veuillez me rassurer que l'honorable Chief est bien en ligne.
Jacob, can you assist Chief Charumbira?
Hello.
Okay.
Hello. I think I'm now connected. Can you confirm?
Yes, we can hear you, sir.
Yes. Thank you very much. Thank you. Sorry for the minor misconnection problems. First of all, can I thank Mr. Gali for inviting me to speak. And secondly, can I say, how are you, honorable members of parliament, who have managed to attend and are participating in this Zoom meeting? It's a great honor to speak to you live in this manner because we have been somewhat disconnected because of the challenges of COVID-19. And I'm grateful that you have put aside most of your engagements in your home countries to be on this Zoom meeting. May I also say thank you very much to the clerk, whom I understand, Mr. Vimpia, whom I understand is making effort to be online and participating, and other members of staff present. A great appreciation goes to SAPST, the lead organizer or initiator working with Pan-African Parliament, including UNICEF, SI, UNESCO, CRNSA, ERNSA, again, also working with Pan-African Parliament to ensure that we meet this morning. It may be afternoon elsewhere, but on the topic, fair financing and tax justice for children in the face of COVID-19. The experts will tell us the effects, the catastrophic effects on human life and other issues regarding the economy and other social that have been caused by COVID-19. This morning we focus on children and by extension, the youth. As we focus on children, we have been told that mainly in terms of scientific analysis and current projections and information collected, COVID-19 is mainly affected the elderly. So it is the old people that are more vulnerable, that are the main face of the pandemic of COVID-19. However, in this meeting, we are saying is the ravaging effects of COVID-19 on the elderly people, not to say that the children or the youth have not been affected. It's not a question of numbers, that the proportion is more of the old. But then the children come in also as a major issue as we talk about COVID-19, because children are also victims of the effects of COVID, both from a health point of view directly, getting sick, and also other effects that then end up affecting the youth. For example, when we talk of the devastations of the economies, those countries that are already, the families that are poor, the vulnerable groups, or the disadvantaged, the effects of the numbers of dying, the effects of the cuts or declines in economic performance are passed on easily to the vulnerable groups and the children. So the children become the indirect victims, or sometimes direct. Already we are aware that a number of countries have closed the schools because of various restrictions and lockdowns. We are all aware that at least 188 countries, according to the Children Report, at least 188 countries imposed countrywide school closures, and about 1.6 billion children have been affected because of this. Again, other effects for children is economic performance declines, apart from education and issue of health. Even water, access to water. A number of households are suffering more, and this is affecting the children in a great and much deeper way. Even within families, issues of violence, domestic violence, between father, mother, within the family, which are then also passed on to children. Children become also direct physical, physically or psychologically. Or sometimes families break down as a result of the economic hardships and other effects of COVID-19. Issues of abuse of children, exploitation of children become more rampant as a result of COVID-19. Effects such as HIV infections, when children in vulnerable groups, poor families, have less access to any form of revenue income, they resort to other means. And sometimes they send children directly to go and find other ways, illicit ways of getting or boosting income in families, or children simply, families when they collapse, children go in the streets, and when they get there, all forms of ills are encountered, and issues like HIV become more prevalent among the children. And this is all to do with the current COVID-19 pandemic. There are various reports by various expert organizations, and these have given us statistics. I will not go into such reports because I believe this will be repeated and probably presented in a much deeper fashion that I can do. I would not gloss over the details and statistics to other presenters. But let me move now to the issue of human capital. Now, when children's capacity to go to school is diminished or affected, some children will fall out of school completely. They will never go back, even after COVID-19. We're not talking of their health and other nutritional issues. This impacts on decline in literacy and education, access to education now, will be felt in the future. And it will have a lot of serious human capital issues. So human capital development index will be affected negatively. And this is a serious issue as we prepare for the future. So as we all say, the children are our future leaders. They are the ones who will pass on the baton, who have people less competent people, less than ourselves, competent people to pass on the baton to. So the future may not be glorious as it is today. Having said all this, the issue of what is the role of Parliament in these circumstances, and in focusing on Pan-African parliaments, where we belong. PAP is a continental parliament. Its role is to coordinate, to harmonize, to make people aware, to pass currently model laws, among others, across the continent. So the role of PAP in this critical situation of COVID-19 and its effects on issues of resources to the youth and children, which will be diminishing as a result of the economic decline. Parliament is the allocator of the resources. And that's where we come very clear. As Pan-African Parliament, we should engage national parliaments and other levels of parliament, the regions, national level, to ensure that parliaments now become more aware and deliberately allocate resources to children, to ensure that the issues of human capital that I've mentioned and other issues affecting the children today, which will also affect us in the future, the effects are minimized. So in the budgets, where we can, let's reallocate resources in the budgets in favor of children. And PAP should work on even model budgets, model bylaws, to ensure that each parliament, whether regional, whether national, is made aware of the need to try and minimize these effects of COVID-19 today, tomorrow, or in the future. Having said all this, I want to again once more say thank you very much to those that are participating to attend this Zoom meeting. And I believe the discussion will be very live and vibrant. We will have an honest exchange of views and come up with recommendations, sound recommendations that various institutions of government, non-governmental, private sector can also take on board. I want to thank you very much and say this meeting, this workshop is opened. I hand back to Mr. Gali, who is chairing the sessions. Thank you very much. Hello, Mr. Gali, I'm done.
Merci, honorable.
Thank you very much, Honorable.
Merci beaucoup, honorable Chief Charumbira.
Thank you very much, Honorable Chief Charumbira, for your words, for your opening statement, having highlighted the role of the Parliament and having addressed the issue of funding and certainly spoken about the mobilization of funds on behalf of children during this COVID-19 pandemic. I would like, with your permission, I would like to give the floor to Lynn and to present to us the agenda and then continue with the process, and would like us to, in fact, lead us through the different presentations, which will be done by the experts. Madam Lynn, you have the floor. Thank you very much.
Thank you, Your Excellency, and thank you, Mr. Gali. I will now present the program as was discussed with SAPST. We've already dispensed with the issue of opening remarks. And thank you very much for standing in for our clerk, Mr. Vipia Harawa. The first item on the agenda will be children and COVID-19, current trends and statistics. And this will be made by Dr. Raji Tashadin, Africa CDC. He is one of our own. And that will be followed by my story from a child representative on the childhood during the coronavirus. I hope that the child is managed to log in, because I was seeing a lot of communication on that matter. And then the next item on the agenda will be the impact of COVID on children in the following sectors: health, education, and social protection. This will be made by UNICEF ESA, Mr. Bob Muchabaiwa, UNESCO, Caroline Modey, Save the Children International, Kennedy Kilmani. And then I will give you the list of the next presenters after this one. So for now, I will call upon Mr. Tajuddin Raji to make his presentation. Mr. Tajuddin, sir. Thank you.
All right. I hope you can see my slide.
Yes, it's all good.
All right. Good afternoon. Good morning, Excellencies, distinguished parliamentarians, ladies and gentlemen. On behalf of Africa CDC, I bring you greetings, and at the same time, thank you for the opportunity to be part of this great webinar. So I will be taking you through children and COVID-19, current trends and statistics. I will start with what is the current COVID situation globally on the continent. I will take you through some experiences from member states. And of course, I will touch a bit on the impact and what is it that we are doing as Africa CDC. And last but not the least, I will conclude. So, distinguished parliamentarians, as of today, for COVID-19, we are looking at 29 million cases globally, with over 927,000 deaths. And it's important to know that 3 out of every 100 cases of COVID-19. Hello, can you hear me?
Yes, we do.
Perfect. So it's important to also note that 3 out of every 100 cases of COVID-19 end up dying or paying the ultimate price for their disease or condition. Coming down to Africa, as of today, we are talking of 1.3 million confirmed cases of COVID-19. This is around 8% of the global total. And in terms of deaths, we are looking at 32,000 deaths, which is just slightly under 5% of global total. And in terms of recovery, I think we have good news to share here. More than 80% of our cases have actually recovered. If you look at the graph on your screen, you will see that the projection has peaked. It has plateaued and is on the downward trend. But I must say here that, yes, this is good news, but we are not yet out of the woods. In epidemiology, we say that it's a lot easier to move from 100 to 10%, but much, much more difficult to move from 10 to 0. So if I unpack the situation in Africa further, you will see that more than 50% of our member states, that's 29 countries, are actually recording less than 5,000 cases. So this is also good news. We have moved from 100 to 120,000 cases weekly in late July to early August to around 50,000 or thereabout cases weekly now. Again, this is a significant improvement, which boils down to all the measures that we have all jointly put together to make sure that the continent does not suffer severe consequences of this COVID-19. So let me share what is the situation as far as our children are concerned. Part of what we do at the Africa CDC is, one, to work closely with our member states. And every week we invite one member state to share their experience with us, and jointly we look at it, advise, and see how do we improve the situation further. So let me start from North Africa. You will see on your screen that about 1.5% of cases are actually children. And if we also go to Mali, we have about 4.9% of cases are children below the age of 15 years. If I shift gear and move to Southern Africa, the same picture, about 4.3% of cases are children. So also in East Africa and Ethiopia, about 4 to 5% of cases are actually children. So you will see that in terms of direct effect, kids or children rather are not that affected, but the indirect effect is where we have issues, because most of the lockdown measures that have been put in place have been counterproductive in a way for our children. So let me start with this slide. You will agree with me that children everywhere, anywhere have been affected, especially through these various socioeconomic measures that we have put in place. And this has resulted in a lot of negative consequences on our kids. Starting from education, this pandemic has created the largest disruption in history as far as our education system is concerned. It has affected nearly 1.6 billion students world over, and this has impacted 99% of students in developing countries. In fact, estimates suggest that 250 million of our children have been affected by this COVID-19 pandemic. Again, if you look at the impact from the human rights point of view, with all apologies to our distinguished parliamentarians listening to this webinar, you will agree with me that the COVID-19 pandemic has exacerbated the pre-existing inequality in our education system. It has further reduced the opportunities for many of the most vulnerable children, children from poor homes, children from refugee camps, children from displaced settings. They have all been severely and inequitably affected as far as this impact of this COVID-19 pandemic is concerned. An estimate suggests that about 23.8 million additional children and youth may actually drop out of school and they will never go back. So this is a time for us to try everything possible to arrest this situation from further worsening. So this is a slide I've borrowed from my colleagues from UNICEF, likely because UNICEF leads our school reopening program as far as the continental strategy is concerned. Again, when you look at the access to digital solution, you will see on your screen that close to 70% of the students from developing countries, especially in Africa, do not have that digital access. So if you talk of distant learning as a solution to the disruption in our education system, whether we like it or not, children from the developing countries, especially in Africa, will fall behind further as far as the education space is concerned. Let's also look at one other aspect that severely affected our children. This is the routine health services. By routine health services, we mean things like immunization, things like sexual and reproductive health rights, maternal and child health, TB, malaria, HIV, and so on and so forth. So due to this COVID-19 lockdown measure, about 80 million children below the age of 1 year are estimated to miss out on life-saving vaccines. We all know the importance of vaccine. In fact, vaccine is one of those most important public health measures that save 2 to 3 million lives every year. So you can imagine 80 million infants missing out of this as a result of disruption in our health services because of the various lockdown measures that we have put in place. Estimates also suggest that close to 1.2 million children and 56,700 mothers who actually die if we don't do something to alleviate or to mitigate some of this impact on our children and their mothers. Again, still talking on routine health services, looking at mental health consequences of this lockdown. Most of our children, most of our students have actually shared their feelings as far as this lockdown is concerned from mental health perspective. Quite a lot of them are feeling all sort of stress from everywhere, from the lockdown, from all sort of abuses, a lot of anxiety, they are feeling lonely, and a lot of them have even got into depression. All these are due to a lot of contact with their school community. Because for some of our children, the safest place for them actually is that school environment. And if we not do anything to this lockdown measure, the prediction is that additional 124,000 1,000 children could actually be infected. So it's like doubling the HIV infection rate on our continent. And this is not what we want. And in addition to doubling the infection rate, even the mortality rate is also expected to possibly double if we do not address some of these lockdown measures. Again, let's look at the impact of this COVID-19 pandemic on food security. Again, about 132 million people may actually go hungry in this year 2020, and 36 million of them are actually going to be children. And for quite a lot of children, you will agree with me, the only opportunity for them to have any nutritious meal is when they go to school, through the school feeding program. So currently, about 370 million children are actually missing out on this nutritious school meal. And what is the consequences of this? The rate of malnutrition on the continent will actually go up, as you can see from this screen. So this is a study that look at what will be the impact of this COVID-19 pandemic on low and middle income country. So you can see on the screen the yellow and the blue line there. So what are the other impacts? Again, ability of many of the parents to work has also been severely disrupted. And this is going to surely lead to household income loss. And whatever gain we think we have made from our poverty eradication, poverty alleviation program will surely be reversed. Again, this will lead to increase in child labor. The vice president clearly articulated this in his opening speech, so I won't go into the details of that. Again, one issue that's come up with this lockdown is increased violence against our women and against our girls, what we describe as gender-based violence. So the statistics are out there. Quite a lot of this issue has really surfaced and is actually on the increase as a result of this lockdown measure. Looking at our young girls again, the rate of teenage pregnancy is also going up because there's lack of access to sexual and reproductive health rights. And again, because of the lockdown, all sort of abuses, and the consequence of some of these abuses is unwanted teenage pregnancy, or teenage pregnancy, simply put. So putting all this together, this impact is likely to extend beyond this generation, and it may actually erase decades of progress if we do not, affirmatively address some of these counterproductive measures. So as Africa CDC, some of these side effects or some of these negative consequences of this COVID-19 actually has led Africa CDC, with support of member states and partners, to launch a campaign that is called Saving Lives, Economies, and Livelihoods. And what does this campaign entail? This is looking at how do we safely reopen most of our borders that have been closed. How do we ensure that travel is safe and this does not lead to unnecessary increase in the number of cases? We know that a lot of businesses have been closed. So how do we protect or safely reopen these businesses? How do we safely reopen our economy, and ensure that at the same time we protect livelihood? And for schools, we have said, or I've said earlier on, that continued lockdown measure is exacerbating the inequality that is already existing as far as access to education is concerned. So part of what this campaign is looking at is how do we safely protect schools? How do we safely reopen schools and at the same time prevent increase in transmission of infections? So in this regard, we have outlined some key objectives on how do we safely reopen our schools. One is to carry out a very comprehensive risk assessment to make sure that it's safe to do so. Two is to carry the community along, because whether we like it or not, the schools are part and parcel of the community. So the parents, the key decision makers in the community, the faith-based organizations, the traditional leaders, everybody needs to be on board. It's a collective effort and it's a collective decision. Then again, we are also working to put in place a robust sort of testing, surveillance, and care as far as the opening of schools is concerned. Then fourthly is to put in place all the necessary public health measures to protect students and staffs within the school environment. These include things like hand washing, use of masks, disinfection of frequently touched surfaces, physical distancing, avoiding unnecessary gathering and crowd, and again, leveraging on the use of technology to make sure that we do this reopening of schools safely. And of course, getting experience from other member states that have robust data on how do we do this reopening of school, or for those that have opened it, what sort of experience can we learn from them? And of course, ongoing risk communication to continue to address misinformation is also key when it comes to the reopening of our schools. So one other thing that Africa CD is actually looking at to further protect our children is the launching of our COVID-19 vaccine development and access strategy. And the key goal of this strategy is that of successful immunization of critical mass of the African population with a safe and effective future COVID-19 vaccine. So we are in a continent where more than half of our population are in the youth to the children age group. So getting this vaccine right is key to reopening our economy, getting back to life and livelihoods as we go along with this pandemic. So, distinguished parliamentarians, to conclude, I would like to say that the COVID-19 pandemic has revealed a lot of cracks in our health systems. It has also reminded us of the need for new and innovative strategies to improve healthcare provision during pandemics and post-pandemic. We must collectively better prepare for emergencies, but also keep investing in not only health systems, but systems for health, because this will fully, I repeat, this will fully respond to people's needs throughout the life course. Again, thank you, Your Excellency, distinguished parliamentarians, partners, and other colleagues who are listening to this webinar. Thank you, and over to the moderator.
Thank you very much, Mr. Tajuddin, for that in-depth presentation. I am sure our members of parliament are taking note. And indeed, the future of the continent is our youth, and we must have robust health practices. If not for now, but at least for the future. And I think that your presentation has set the ball rolling in terms of why we are meeting here today. But allow me just to ask the SAPST Trust to give us the objectives for this meeting in detail, so that we are clear and we are sure of what we intend to achieve from this mission, from this meeting. I'll therefore ask the SAPST Trust to give us an outline of the objectives and the expected outcomes of this meeting. Thank you.
Thank you very much, Madam, for inviting us to make a contribution during this discussion. Your Excellency, the Vice President of the Pan-African Parliament, Honorable Chief Charumbira, honorable members of Parliament participating in this discussion, the Clerk of the Pan-African Parliament, represented by Mr. Gali, who chaired the opening session, the senior managers of the Pan-African Parliament are in participation in this webinar, and other members of the Pan-African Parliament Secretariat, representatives of development partners and civil society organizations represented in this webinar, with special reference to Save the Children International, that our funding partners. We thank you very much, honorable members and the Secretariat and other participants in this webinar for taking time to discuss the issue of tax financing of children during a pandemic. The Southern African Parliamentary Support Trust has been working with various parliaments on the continent, the key objective being to make a contribution towards the capacity of parliaments in the discharge of their mandates, in particular their oversight roles, their representative function, as well as their legislative function. And we are particularly pleased to be partnering with the Pan-African Parliament, considering the fact that it plays a coordination role with respect to other parliaments on the continent. This discussion is coming at a time that can certainly not be described as ordinary. These are extraordinary times. We are having to conduct this discussion virtually because of restrictions that have been imposed across the globe on the movement of persons and people across borders. The consequence of the pandemic has been enormous, both in terms of economics, in economies of countries around the world, as well as the health dimension. This has also impacted on the lives and livelihoods of societies across the board. So this is the background to this particular discussion. Why did we, request partnership in terms of this discussion? It is particularly because parliaments play a key role in terms of discussions around budgets across the world. They play a key role in facilitating discussions. They represent diverse communities in their countries, and they have a key role in shaping the budgets of countries across the continent. So it is in this regard that we would want to enhance discussions around tax justice with particular reference to a grouping of society that does not have representatives in a number of parliaments on the continent. So it is because of that that we would want our parliamentarians to take special measures in order to ensure that children and their interests are accommodated. I would say that given the statistics that we have been given at the opening by Honorable Chief Charumbira, as well as the presentation that we've just had, I think the work of Parliament is cut out. They have a lot of work to do in terms of ensuring that as countries levy taxes, they always have children's interests at heart, because it is the interests of the children that will shape tomorrow as dispensations. So with those few remarks, I'll give the floor back to you, Madam Chwandamira, and thank everyone for participating in this discussion. Thank you very much.
Thank you very much, Dr. Nyashanu. We will now get the testimony from the girl who is going to tell us a story about the way our young people are coping within this COVID-19 pandemic.
A very good afternoon to you, ladies. Can you hear me?
I think she's muted.
Can you hear me?
Yes, we do hear you.
Okay. Good afternoon, ladies and gentlemen. All protocols observed.
The connection is very poor, ma'am.
Zimbabwe National Council for the Welfare of Children. So today I'm going to be highlighting on the...
We still can't hear you. Can you please, did you choose your language? You choose English as your language before you speak.
Okay.
We can't hear you. Just make sure you choose the pro language first. You confirm and then you can try again. Yes, thank you.
Can you hear me? Can you hear me now? Can you hear me now? So I'm going to be talking about the issues and experiences during the COVID-19 among children. So one of the most issues that children are
sorry, we can't hear.
Okay.
Just make sure that the volume of your device is up. Also, your headset is well set up.